Can effective recurrence monitoring lead to long-term reproductive cancer remission? Imagine living with the hope that careful watchfulness could help keep cancer at bay for years. That's what recurrence monitoring aims to do for those with reproductive cancers like testicular, cervical, or ovarian cancer. When cancer is initially treated successfully, doctors often recommend ongoing surveillance to catch any signs of the disease returning early. The idea is that catching a recurrence early might make treatment more effective and possibly lead to longer periods of remission. But it's important to understand that monitoring alone doesn't guarantee a cure or long-term remission. It's just one piece of a larger puzzle that includes timely medical interventions. Recurrence monitoring is designed to find the cancer again before symptoms appear or when it's still small and more manageable. This early detection can sometimes improve the chances of successful treatment. For example, in ovarian cancer, doctors often use blood tests to measure tumor markers like Ca125 and He4. These markers can signal relapse before symptoms develop. Imaging tests like CORT scans or PET scans are also used to look for signs of cancer returning. For testicular cancer, tumor markers such as alpha-fetoprotein and human chorionic gonadotropin are checked regularly, along with imaging, to catch any early signs of recurrence. In cervical cancer, physical exams and symptom reports are key, as routine cytology tests are less useful for detecting recurrence in asymptomatic patients. The effectiveness of these tools varies. Combining biomarker tests with imaging improves the chances of detecting recurrence early. For ovarian cancer, using both Ca125 and He4 can help identify relapse sooner, which may allow for more effective secondary treatments like surgery or chemotherapy. In testicular cancer, early detection through tumor markers often leads to prompt treatment and better outcomes. While physical exams and symptom checks are helpful, they are usually not enough alone to catch recurrence early, especially in ovarian and testicular cancers. Detecting recurrence early can sometimes lead to better long-term outcomes. When doctors find cancer before symptoms appear, they can act quickly with treatments that might be more successful. For example, early detection of ovarian cancer recurrence can make it possible to perform surgery to remove remaining cancer and improve survival chances. Similarly, in testicular cancer, catching a relapse early often means treatment can be more straightforward and effective. However, it's important to note that intensive surveillance, such as frequent scans or blood tests, may not always translate into longer survival for all patients, especially those at low risk. Overdoing tests can also cause unnecessary anxiety, false alarms, and additional procedures that might not benefit the patient. Guidelines from health authorities recommend personalized follow-up plans based on the type of cancer, how advanced it was, and individual risk factors. Most guidelines emphasize routine physical exams and symptom checks as the foundation of follow-up care. Biomarker testing and imaging are used selectively to improve detection, but routine testing without clear signs of recurrence is discouraged to avoid unnecessary procedures and stress. The goal is to balance early detection with quality of life, avoiding overtesting that might cause more harm than good. It's also crucial to remember that no surveillance strategy can prevent recurrence or guarantee a cure. The main aim is to catch any signs of cancer returning early enough to give the best chance for successful treatment. Each person's situation is unique, and follow-up protocols should be tailored accordingly. Psychological support and attention to quality of life are also vital parts of long-term survivorship. In summary, effective recurrence monitoring, using a combination of symptom assessments, biomarker tests, and imaging, can help detect cancer early, which might improve treatment success and support long-term remission. But it must be part of a comprehensive, individualized care plan that involves timely medical intervention. Always consult healthcare professionals for personalized advice and follow their guidance to optimize health and well-being after cancer treatment.